You know, according to many, it's one of the biggest problems facing meaningful health care reform, and it was never even part of the current health care reform debate and bill now being pushed through Washington. We're talking about tort reform. And here to explain what that is and why it's so important is Dr. Robert Russo. He's a radiologist who owns his own practice in Connecticut. And let's talk about this a bit, because sometimes the words tort reform just bounce around. People don't think about it very much. But tell me exactly what you'd like to see happen from your practice and from the practice of other doctors out there to the laws governing how you can be sued if something goes haywire.
Yes, I think it's important that when you look at this part of the debate in the healthcare plans, that we understand that doctors are not against patients who are wrong reaching some sort of compensation. That isn't the issue. The issue is what these malpractice cases, some of them quite frivolous, cause the doctors themselves to do.
Such as?
In my practice, I'm a radiologist, which is high tech. We do a lot of testing. And we see referrals from other doctors. When we get these referrals, you wonder, why are they ordering that test? So you interface with that doctor and you'll say, look, we did the CAT scan. Why are we doing the MR? And the answer is, well, I want to be sure. I don't want to be caught making a mistake. There's a tremendous amount of paranoia developing because our referring physicians are beginning to feel that they're not just treating the patient, they're treating the patient's attorneys. So unnecessary testing gets in the way. I mean, myself as a radiologist and other radiologists are really very interested in doing good work, the right work on the right patients. We're not interested in defensive medicine, where a doctor's under pressure because, well, for example, we do a mammography. It's about 88 to 92% accurate. If you add an ultrasound, it goes up to 94%. If you add an MR, it goes up to like 96, 97. Well, is it really the best care for the dollar in our system with all these tests creeping just slowly? So until we can take the pressure off so that doctors can get back to the doctor-patient relationship and not the statistical data. I mean, what's happened, there's so much data out there now. Experience or the art of medicine doesn't count as much.
Well, let me talk to you about just the specifics. In your own practice, you have to pay a substantial, I guess, premium for your malpractice insurance.
Yes.
Plus, if you add the cost of defensive medicine on top of that, can you give me some idea of the percentage that we're talking about here that goes of our healthcare dollar that goes into defending against a malpractice suit and insuring against a malpractice suit?
Right. In our practice, which is, again, a radiology specialty, which is the high end, we spend about 20% of the revenue that comes in either on unnecessary testing or on defense and premiums for the malpractice.
So if there was significant tort reform, there would still be some cost involved in some way to provide for people who are wronged.
Yes.
But how much could you bring that 20% down, do you think, logically, rationally?
Probably somewhere in the neighborhood of 15 to 16%.
So you could go down to 5%.
Right.
So you could we could knock 15% off the cost of health care right now?
Yes.
By simply,
without a doubt,
executing tort reform?
Yes, and the reforms that come with it, which will be the ability of the doctors to then go back to practicing medicine and not practicing defense.
So why don't you think it's part of the program if it's such an obvious way to save a ton of money?
There's too much money in it. If you follow the money in these, you'll see that there's profit by malpractice insurance companies, there's profit to the trial lawyers that are involved in the process, there's profit to the marketing people that sell these tests in batches and things like that. It's the same problem that the rest of the healthcare plan is having. That in the old days, my father's day, it was doctor-patient. Now it's so much money, there's people from the outside, inside, taking their piece and seeing how to work the system.
Well, Dr. Russo, thanks for coming in. We appreciate it.
Thank you very much for having me.
Viewpoint.
Thanks.
A sensitive report on the screening manual was leaked